It's Etch back with another health highlight from Michigan Primary Care Partners and Y102. Now, over the last couple of weeks, we've covered everything from stroke and dementia to Lyme disease and heart health, lots of different things. So let's focus this week on something a little bit closer to our heart. Our parents, those who are starting to get a little bit more older in age. And one of the things that I always hear out of my dad is a lot of stubbornness. My grandparents as well. When they go to the doctor, it's generally for one thing that they're having an issue with. And they don't want to go and get screened, right? Just don't worry about me unless I'm having serious problems, then I'll go in. But other than that, worry about yourself, That's what I always hear from my dad. So, with that being said, did you know that if they're on Medicare, that they offer a free wellness checkup at Michigan Primary Care Partners? And that's something that you can have done for your parents, your grandparents. They can have done for themselves as well. That will focus on risk areas and also possibly help avoid unnecessary procedures and sicknesses and accidents. So all Michigan Primary Care Partners facilities offer this free Medicare wellness visit, and you can get one scheduled by calling 231-592-1360 for details. Let's find out more from Michigan Primary Care Partners on this week's Health Highlight with Y102.
A wellness exam is important because that is the one exam where you sit down with your provider and you go over all these things that you sometimes don't have time to go over during a regular office visit. For example, one of the things we always address on a wellness exam is are you at risk for falling? Are you at risk for dementia? Do you have an advanced healthcare planning? Do you have an advocate who can speak for you in case you cannot speak? So when you go to your provider to see them for hypertension or diabetes or heart disease, sometimes we are so focused on your disease that we tend to neglect these preventive measures that can be placed so that you don't fall, you don't break a hip, you don't end up in a nursing home.
Part of the assessment also includes, and this fits into the idea that Michigan Primary Care Partners is a medical home. The medical home looks at who are your other providers involved in your health care. Are you getting eye visits? Are you getting hearing visits? Are you doing dental exams if you need to have those? We also bring together the cardiologist, the pulmonologist, and make sure that everybody's on the same page.
So there are resources that is available to the patient that they are not aware of, and unless you also sit down and pay attention to these little nuances of living, you don't know yourself. But they can have help for being brought to the appointments, they can help with meals, they can have help with having a nurse come in and checking their vitals, they can have PT/OT at home if their balance is off or if their big muscles are getting weaker.
To many of my patients, when I talk about this particular Medicare wellness visit, the thought is, I'm not really sick. And well, that's the whole point. We'd like to keep you that way.